Joining us from Boston now is Dr. Yaneer Bar Yam. He's the president of New England Complex Systems Institute and co-founder of the COVID-19 Action Group. Welcome to the show, sir.
Thank you.
So the vaccination rates here in the U.S. seem to be dipping. Do you think President Biden's July 4th goal to have 70% of adults inoculated will be met? And what are the implications either way?
So the big challenge, of course, is to ensure that vaccinations are sufficient to cause cases to go down dramatically, not to achieve any particular goal. And so the challenge is not just that the vaccinations are not meeting the rate that would allow a particular goal to be achieved, but rather the question is whether the combination of the vaccinations with other social actions, including masks and including social distancing, will be sufficient to keep cases going down. And given the recent relaxation of guidance by the CDC that is indicating that many people do not need to wear masks, in particular people who are vaccinated, but that is not a situation that is clear because many people are not known whether they're vaccinated or not. So the fact that people who may not be vaccinated might also not be wearing masks is creating additional risk for transmission. And with the new variants, in particular the what is now called the Delta variant originating in India, which is now growing in the US, may cause new challenges to the outbreak control in the U.S.
I'm glad you bring up these social measures because, I mean, walking down the street in most places now, you'd think the pandemic is over here in the U.S. People are congregating without masks, restaurants are bustling. And Doctor, are there fears that this return to normal activity might drive a summer surge in infections?
So there is no doubt that if restrictions are relaxed, if the social behavior pretends that the pandemic is gone when it is not, that there is risk of new growth of cases. And there is beginning to be an indication that this may be happening. Now, what seems to be the case, and this is a positive statement, is that the vaccine, even at the level that is currently present, and the restrictions at the level that are currently present, have been able to cause cases to go down in many parts of the country. But the rate of vaccination is highly heterogeneous. Some states have much higher vaccination rates, particularly, for example, Vermont and Massachusetts, and in the Northeast in general, whereas other states have much, much lower vaccination rates. So it's impossible to treat the current situation as saying that there is a particular vaccination rate. In fact, the difference between communities means that some communities are much more at risk than others in having new outbreaks, and in particular with the new variants and the Delta variant, there may be new strong outbreaks and a new wave of infections.